All right. Well, it's just a super pleasure tonight to work with one of our clinic directors. His name is Dr. Axel Martinez. You can't see his screen, unfortunately, because we have a little technical difficulties. But I will say this, we should be good to go. What he's about to present, we saw at the Shockwave Business Academy, and it was extraordinary. And he won Best Researcher and White Paper. So without further ado, I'm going to start with my man, Dr. Axel Martinez. Go ahead, sir.
All right. Thank you so much, Doc. Okay. You know, the first thing I want to say is thank you to Dr. Diduro for inviting me here. We've been working very hard for the last 2 years. Really deep in dive in what's going on with the Softwave. Okay, let me see if I can everyone hear what I'm saying right now?
Yes, they can, and I've got them all muted, so keep going.
Okay, so okay, there you go. Okay, so you know, one of the things that I presented in the New York reunion was what's really happening. You know, what's the interplay? Why is Softwave so efficient, right? Like, really, there's no other modality that can do what we're doing, and there's a reason behind that, right? Why it is important to me, right? So if we're recommending patients to come 8 visits, 12 visits, 16 visits, why are we doing? How are we measuring what we're doing? So if we measure what we're doing, we're gonna have leverage, right? I know we're here, we're chiropractors, physical therapists, medical doctors, podiatrists. We're a big group right now, plastic surgeons, you know? So we're really using Softwave to treat many conditions. Too much, I would say. And it is efficient, every time efficient, right? So these past 2 years, Dr. Diduro gave me the hard task, you know, to kind of run his clinic. And he was seeing a lot of chronic conditions, very difficult conditions, you know, neuropathy being one of them, even movement disorders. A lot of the chronic, you know, tennis elbow, osteoarthritis, rheumatoid arthritis, balance disorders, some wounds. So it's a very big gamma, you know, the spectrum is so big. And the reason why is because I think Softwave for me was the missing link in all the diversity. All, you know, Softwave can really marry and make the marriage between a plastic surgeon and a chiropractor. You know, we have so much in common that the people, the doctors, the healthcare providers that go into Softwave, they really will be challenged in a clinical way, because you're gonna see patients that no one can do nothing for them.
That's right. I mean, that's one of the things that I love, Doc, is that, you know, we go to these research symposiums in Europe, and there's 200 different doctors, and there's trauma surgeons, there's cardiologists, there's wound specialists, there's orthopedic urologists, chiropractors, physios, all with one goal to elevate Softwave and really make this treatment for the masses. So you're right. I mean, and we have to see some tough cases because they've been to doctor after doctor. So go ahead. Thank you.
Okay. All right. So that really gets me excited. You know, every morning, it's not like I'm not making this up, you know. I wake up every morning and I want to see patients with this technology, you know, because I know. So what's my background? You know, my background. I'm a chiropractor. Okay, I love neurology also, but you know, sometimes people think, you know, the old way, and that's. So tonight we're gonna get a new eyes. We're gonna start seeing patients with different eyes, because Softwave will require you to be that doctor. Okay, if you have Softwave, you need to be on top of the research, because when you go to a medical doctor, when your patient goes to their rheumatologist, when their patients go to their diabetes doctor, when their patients go to their orthopedics, none of them knows, you know, right now they're using cortisone. They're using all this kind of invasive stuff that we know doesn't work. Why we say that? Why I'm confident saying that? Because I have Softwave. Okay, so in 5 years from now, 10 years from now, Softwave is gonna be everywhere, because if that doesn't happen, people will know. It's that simple. People will know. Okay, so that being said, I'm gonna talk today about concepts. Okay, so this picture here, it's a concept. Okay, this is Softwave. I'm gonna talk about neurology. Don't get, you know, don't think, oh, that's too complex. No, I'm gonna talk about neurology because of the Softwave. Okay, and Dr. Diduro created the 10 minutes protocol, and we're gonna start teaching how to assess the neurology of the patient, how to assess their orthopedic way in 10 minutes. We're not adding, you know what I mean? I'm not getting this too complex. I just want you guys to understand the concept. All right. So that circle right there in the middle, all those lines, right? What do you think about that, Matt? When you see that picture?
I want it as a tattoo. It's so beautiful.
So all those lines, it's just gray matter. This is very important. Gray matter, that's in the brain, okay? Why I'm throwing this right in the front? See how connected is your body. See how connected is your body, your patient's body, your own body, your mother body, your wife body. Right? So what does that mean for us? And we've seen this clinic, everything I'm talking tonight, I've seen it clinically, okay? I'm not talking about stuff that we don't treat, we don't practice, okay? Everything that I'm talking today, we've seen in our clinic. So what this means for us, it's that pain. Let's talk about pain. People don't like talking about pain, right? People, we've been struggling with pain for, wow, 50 years now. Knee pain. Doctor, what can I do with my knee pain? Oh, just, you know, exercise and drink water. There's a lot of people suffering because we doctors don't understand that pain. There's no nerve. There's no one nerve in your body for pain. There's no nerve in the body that carries pain signals, okay? Why I'm saying that? Well, I started to read about the history of pain because I was practicing and seeing how Softwave was amazing. And I was like, what I'm even looking at, you know, what's happening here? How is this happening? You know? Okay, so this is what happens. So that first name there, okay, William Nordenbus, that doctor delineated the ascending pathways. Okay, so we know if you put your hand in your hot, thing right there, you're gonna create a reflex response. You're gonna go away from that. Okay, why? Because you have emotional centers that tell you, don't do that, it hurts, I don't feel good. That's your brain. That's your amygdala. That's an emotional pain. Okay, different triggers, we're going to talk about that. Different triggers. Not every knee pain, it's a knee pain. That's why surgeries are been failing, really. I was going to say, why? Because not every knee pain, it's mechanical pain. Not every knee meniscus or knee cartilage that it's blown away, it's because you were a runner for 30 years. Some cases they are, other cases they're done. When you look at their history, they have so much under that. Oh, sorry.
Welcome to.
When you look at their history and you start digging deep, what's happening. You start to see the big picture. Okay, this is about big picture. We don't want to memorize anything. Okay. So William Nordenbos, he created the pain path. I say that's wrong. But in my mind, I see that guy that he created those pathways. Okay, so everything that they teach us at your school, it's because of him. Okay. And then Melsack and Wall, they came up a little bit more modern theory of pain. And they said, hey, maybe the brain, the emotions, all of that matters. Perfect. Okay. But then I found this article right here. I'm going to go back. This article. You see that, Dr. Diderot?
Yes, sir. Looks good.
Okay. Okay. This is key for Softwave. And this is key for all doctors that have this machine. It doesn't matter who you are. Okay? So take a deep look here. History of spinal cord pain pathways, including the pathways not taken. So what happens is Adam Bassbaum, he was very famous. And he was a student of William Nordenbos, okay? What happened was that when Melsack and Wall, they took Nordenbos' work, okay? And they kind of twisted it a little bit, all right? What's the problem with that? This is the problem, right here. Because when we come with the Softwave and we tell the patient, okay, let's say figure number C, everyone can, I think you guys can see it. Figure number C, Brown-Séquard syndrome. What's happening? So I feel something in my knee, and 2-3 segments up, it's gonna go in the other side. And that's been the pain model for these past, 60 years. Okay. Okay, look at figure number F. Can you see that, Matt?
Yes, sir. F.
Synaptic pathway.
Yeah.
That's how pain that's the most pure signal that we can represent in a diagram. Okay, look those 3 lines. It takes your whole spinal cord. Look at figure number C. Oh, heat or cold, and then it's gonna go up. 2-3 segments up, it's gonna cross. But really, when the knee pain, when you see the hip patient, when you see the failed surgery back patient with 4 surgeries, when you see ankle pain, neck pain, what's really happening is that pathway number F it's going awry, it's going down. Okay. Okay, let's do a quick case. You have a patient with both knees. Both knees. One knee hurts, the left one hurts, the right side doesn't hurt. But you already evaluated and you saw that it's inflamed, but he has more pain on the left. Okay. So, okay, Mr. Smith, let's treat your left knee. We treat the left knee, we make him walk. Okay, gait is very important. We always take patients and we make them move. What's different? Oh, I don't feel any pain here now, but I feel something in the other one. Have you seen that, Dr. Matt?
Awesome. Yeah, all the time. I mean,
right.
You decrease the pain in one side. What do I always say to him? That knee is the same age as the bad knee, you know?
Right. So before they didn't felt it, the signal was there. But before, the brain only has so much energy for attention. And that's the problem of chronic pain. That's why we're here. And that's why Softwave, it's gonna be the new iPhone. Softwave, everyone will need to have Softwave. Because the opioid crisis right now can't address what we're talking today. These pathways, never. That's the importance, okay? All right, let's keep going. Let's see here. All right, so gray matter alterations in chronic pain. Okay, let's take a look. White matter, okay, just connection. This is very simple because this is your everyday patient, okay? I'm not looking at research for the sake of looking at it, okay? I'm very practical. I like clinical stuff. And I think that's where Softwave shines better on the clinical side. So what they're saying here, it's, listen, chronic pain, chronic conditions makes the gray matter to go down, okay? Okay, how we measure it, how can we know that chronic pain really shrinks your brain? And this point is what we don't understand. Once you have central changes, that's a different beast. That knee pain is not knee pain anymore. It's a nervous system problem now, okay? Because we saw it here, all those, I mean, I can write here or not? Let me check.
We're not seeing
Okay.
writing.
No, I'm not writing. So I'm not writing. Let's see if I can write. Okay, let's come here again. Again, this is your everyday patient, guys. So this is very important. You see how integrated it's your pain experience. That's why if you had a bad day or a stress or whatever, all your pain comes up, you know. It's like, oh my God, you know, whatever I'm stressed, that's when the low back comes. Doc, it's not every day. I mean, it's not constant. It's just, you know, if I had a bad day at work, oh, my low back will be, you know, on fire. I know that's a brain pain. That's brain pain. Okay? That's brain pain. When they have something else on top of the normal condition, that's where the brain loses the ability to inhibit. It can't inhibit all these guys. Okay, let's keep going. So your patient is gonna be like, oh, I had a bad day, and you know, my knee, you're not doing anything for my knee, doc. But they don't know it's their brain. Okay, how do we measure? Well, we look at the autonomic nervous system, okay, your heart rate. We look at your respirations, you look at your blood pressures and you start to measure, okay? So let's keep it simple. That's your patient. When you treat a knee, when you treat a bad shoulder, necks, low backs, heart, if you're a surgeon, and Dr. Matt, who else do we have here?
Well, we have naturopaths, we have functional medicine doctors, right?
Yes.
So the gut and the brain have such a great pathway.
Yes.
And,
yes.
And just to give our participants some hindsight, is that we do autonomic testing on all patients that come in our clinic. So we're looking and tracking and getting baselines, not just mapping out the painful area. But keep going, we like it.
Okay, perfect. So when your patient comes, okay, this is physiology 2021. This is research from 2021, okay? That's how they're looking at the body right now. How connected is your body? All right, so maybe, let me see if I can write. Yes, I can write. Maybe your arrhythmia, it's coming because your vagus nerve or your medulla, better said, down here is dysregulated. And those arrhythmias feedback into your muscle system, your musculoskeletal system, right? And you have a patient, I'm the chiropractor, right? So he's gonna come to my office, and what I'm gonna see, heart stuff, it's very common to see shoulder problems, okay? Why? How can I say that? Well, I know how the autonomics play into the pain signal. So if you don't have good heart rate, good respiration, your blood pressure control, it's here. It's everything, it's connected, right? So from your gut, look at the gut, how strong it is. He fires into everything, into your stomach, your brain. We have gut lung axis. We have brain lung axis. We have brain muscle axis. We have brain heart axis. Everything is connected, okay? And so we're gonna dissect that very quick, very practical way. Okay, I found this research today, I think, this morning. PSO1, how Softwave works. Okay, we already talked about the brain, okay? That's like a big picture thing. Okay, let's go into what we want to talk about, Softwave. Okay, Softwave, it's a somatosensory therapy, okay? Softwave triggers PSO1 receptors. Softwave triggers PSO1, and we have PSO2. I'm going to talk about it very soon. So if we go back, okay, they're studying physiology in a such connected matter, okay? That means we have the strongest weapon. Why? Because we can influence all these systems with the same modality. Softwave. Softwave can influence muscle tissue. Softwave can influence heart tissue. Matt, we have research, right?
Yeah, we have Johannes Holfeld, who's done 65 bypass surgeries.
That's incredible, right? So we know Softwave influence how. In my mind, I was practicing, I was asking me, how can Softwave, how is people treating heart conditions with Softwave? Why? How are we doing so much phenomenal work with musculoskeletal, functional medicine docs? We have a naturopathic doctor in our clinic, and it's the best thing. It blends so well. And it's gonna help your patients so much more if you blend those two. Okay, so They're studying physiology like that, and this is what we're doing. We're triggering Softwave. So if we go with Softwave, you know, in my case, chiropractor, right? Articular cartilage, I can influence that, all right? So now suddenly the rheumatoid patient is gonna be mine because there's really nothing for it. Okay, I can influence dorsal root, that's sensory. So this problem, that's chiropractic bread and butter. But we have more. We have skin, we have lungs. So it doesn't matter your specialty. I'm talking about a big concept. And you should be able to mix it and blend it in your own clinic, and it's gonna be very successful. That's the great part. Okay, so this is how we measure, okay? Again, parasympathetics, sympathetics, but we need two things. We need density. You see how beautiful these lines? We need density, and we need connection between each two, okay? Why? Well, you don't want to be in chronic pain. This is what happens to you. You don't want to be in severe chronic pain. That's how your brain shrinks. And the first network gets shrink, it's your white matter autonomics. How can I find that? Well, your autoimmune patients that comes with pain everywhere, your fibromyalgia patients, they are hurting everywhere. You know, your back surgeries, they have changes here, the white matter. So the brain spends too much energy feeling pain that, you know, all the other networks starts to get dysregulated. And that's how it starts to shrink. And why this is important? Well, because if you have a good brain, you're going to inhibit pain.
Say that again. Write that down, everybody. Take some notes. Listen to this. When you have that patient that's filled out the pain diagram, and it's like they colored the whole thing and they can't stay within the lines, that's what he's talking about. These are the patients that are in rough shape. And the way Chris Coloca always taught me, it's like pain threshold is like a glass of water, or right? And most people, you have this much pain and you take this much threshold to overstimulate it. Or but people with chronic type of pain, their glass is almost filled to the brim already, the rim. And so when you get this, right, any type of stimulus,
it's going to be painful.
There you go. And so that's how and we have a big percentage of those patients that are coming in our clinic, right, Axel?
Yes, but this is my point. So I graduated and I went straight with Dr. DiZuro's office, and people are struggling with knee pain. No one told me that at school, you know, like I didn't know that. That for me, that was the most weird thing. I was like, is this really happening? I mean, we're getting great results because of the Softwave and the way we're doing it. And that's very important. That's what I'm teaching today, a concept. The way we're doing it, we're looking at the brain first. And it's very simple. You need a good brain to inhibit pain. But even more than that, with Softwave, 90% of those cases, you know, 65% to 90%, they get well, you know, they improve, okay? I'm not talking here about the peripheral changes, the stem cells, the angiogenetic component of the therapy. I'm not talking about the nerve regeneration component. I'm just talking about effectiveness. Being effective is different than being a specialist. Because I'm not a specialist in rheumatoid arthritis, but I can treat those patients and change their life. Okay, so all that crowd is gonna be pulled into your offices. Okay, perfect. Let's keep going. This is very important right here.
Make sure to mute if you're not on, and God bless you, whoever that was.
Dr. Serrano. Okay, next slide. Real quick, I'm gonna stop talking about the brain. Here, that's the Softwave. Why? Because we've asked patients, tell me when you feel pain, right? Why are we doing that? That's my first question.
I'll help answer. We're using the biofeedback component through
Right.
nanotransduction, where the cell membrane cannot withstand the constant compression and expansion. And that's typically helps us pinpoint where the abnormal tissue or damage or poor circulation or inflammation is.
Right. This is my theory. Okay, this is me. This is not the research. I'm pulling all the research from everyone to create my own idea. Okay, let me know when you feel pain and your patient is a knee patient. Softwave.
Doc, you just got muted a little. We can't hear you as well.
You hear me now?
Yes.
Okay. So knee pain, we do the Softwave, and this is what happens. They feel pain. So if they're feeling pain, this pathway is being fired, because that's how neurology works. When you feel pain, you're gonna come all the way here and you're gonna impact your autonomics. That's why we measure them. The midbrain, pons and medulla, it's your autonomics. That's how we track.
And if they're here's one quick thing that we talked with Dr. Antonucci, Matt Antonucci, about is also if they are feeling the pain, we're affecting their brain.
Yeah, yeah. And that's what I'm saying. What I'm saying is that pain, it's in your brain. It doesn't matter if you had a trauma. It doesn't matter if you know, and that's the old way of thinking. It's okay, you've been running for 30 years. It's, you know, you must have pain, you know. Oh, you don't have cartilage because you were a basketball player. Okay, that's not supposed to happen, right? And why can't we change that with the Softwave? That's the question. Because 20 years ago, this was impossible. Okay, so what's happening is that we're using pain to treat pain. I told Dr. Matt. Why? Because when they feel pain here, we're firing this thing right here. Real quick. Here is your new brain. So a signal is going to your new brain, and that's location. That's why when they feel the Softwave in their knee, okay, I don't feel it in the medial side, but that top, dog, you know, that kneecap is hurting a lot. How do they know? It's because this is happening. Okay. Normally, when we come from here, we fire the emotional brain first, and that's why it's stronger. And your stronger pain signal is gonna inhibit your new brain. So you can't locate the pain. I know it's in the knee, but I don't know where. It's just burning. It's achy, it's dull, you know, it's stabbing, but I can't point to it. That's why this is going like crazy. But when we use Softwave, we're gonna go this route. The lateral route, the new route, the cortex route. And we're remapping the brain.
So it's funny, and I'm sure a lot of our doctors and participants have noticed this. Did you ever notice, like, if someone's had a pain for like 5, 10, and 15 years, you use Softwave on them, and then afterwards, they literally tell you about their original trauma. It's almost like they have this limbic response, Doc. Where
Yes.
it's like, right? So where is that coming from? Is that coming from the old part over here? And then,
Yeah. So, okay, let's go there. I didn't want to do it, but you forced me. So that's your memories. That's your temporal lobe. Memories. Okay. And you see here, dorsal anterior insula. That's your gut. That's your heart. That's your lung. That's the map of your brain for your organs. Your organs, your interoception, okay? Your gut, your stomach, your heart, your lungs. They tie with your memories. And we're changing those brain regions with the Softwave. That's why that happens, Dr. Matt. So the patient feels the change. They feel the change, and they have a limbic response. You know, oh, this is what really happened, etc., etc. Okay. All right. This is the same slide. I'm not gonna go here. Neither here. Okay, Matt, are we live?
are we live or Memorex? We are live.
Okay, okay. This is very important, guys. I'm gonna go quick through it, but this is the stone, the keystone for Softwave right here. So with Softwave, we are creating changes here, mechanotransduction. And this is what happens. If you want to know how Softwave works, this is it. That's what we're doing. We're creating physical force, mechanotransduction into the cell. We create intracellular changes, and we have more ATP, nitric oxide, and we have so much more, but you know, I'm just teaching the basics, okay? And we're changing the cells. Perfect. How do we know? Well, this researcher, Pataputian, you can look it at in Google, you know, he won the Nobel Prize like 2 years ago or last year, I think, because he found this receptor, the piezo. This is the piezo. How pretty, okay? And they found that your heart expressed piezo, your knee, your stomach, everywhere in the body, we have piezo. So look at here, heart development, it's done by piezo receptor. Even adipocytes, bone, pancreas. Wow, I read this, I don't believe it. Lung. We have here your spinal cord and your brain, piezo too. Bone development. And you know, when I saw that, I was like, wow. You know, I remember reading about this, and I was thinking like, maybe this is the way Softwave is working. And so mechanical force, this is what happens. The cell feels the mechanical force and it triggers the response. It can be vascular tissue, it can be your spine, your chondrocytes, your cartilage. Look right here. Are we treating this? Yes. Do we have doctor treating this, Dr. Matt Diduro?
Yes, absolutely.
Okay. Here, do we have doctors treating this? Do we have neurologists? do we have, you know, everyone that has the Softwave needs to understand these concepts.
So you're unlocking, you think that Softwave may be the key that unlocks also PZO, correct? And
Yeah.
as well as the toll-like receptor 3. How do you bring these all together? Have you figured this out yet?
So Softwave, it's the connection, okay, between the brain and body. It's the most effective therapy we're gonna have that, you know, can cover so much more. But what happens with the toll-like receptors, okay, this is a bad knee. I just wanted to see how good the picture was. And, you know, we have 90%, you know, 65 to 91% effectiveness. And that's really, really big. Again,
Go
here,
back to that one, Doc. Go back to that. One of the reasons why joint replacement in the knee is unsuccessful is 33% of the time it's coming from the nerve. It's coming from, so sometimes that's why 33% of joint replacements are failures. It's not the actual cartilage or the joint.
Right. And you know, we impact both. That's what we need to understand. We're not treating just peripheral tissue. We're treating the brain, okay? We just saw the pathways. We're affecting the interoceptive system, your somatosensory system in the cortical level, okay? We are affecting memories. We have patients crying because we're triggering that brain response in conjunction with your, you know, your meniscus, okay? So we have, if you have so much weight on your body, you know, but we can really change your brain, okay? Okay, so piezo expressed in all of those different regions, okay? This is piezo2, it's the same. I'm showing here the same response again, okay? So that's the mechanotransduction part. Again, we express piezo everywhere. Cardiovascular, sensory, more bone. There's a lot of research on bone. It's great. We affect interoception. Oh, so I included here that part. So your vagus nerve goes down and innervates your lungs, right? So that's the vagus nerve, and they express piezo2. So they sense your mechanical stretch of the muscle, and they convert that into chemical and sensory afferent to your medulla. Okay, that's awesome. That's really, really awesome. So PSR, it's everywhere. Okay. All right, last component of the presentation, what Dr. Matt loved the most. We're changing the immune response at the peripheral level. You know, what happens is we have two main components, toll-like receptor 4, toll-like receptor 3. Toll-like receptor 3 is the only toll-like receptor that it's inside the cell. Toll-like receptor 4, it's outside the cell. Okay. What happens is when we use the Softwave, because of the piezo we're firing, doesn't matter if you're doing lungs, knee, low back, if you're a heart surgeon or plastic surgeon or chiropractor, medical doctor, PTs, everyone, this is what we're doing. We're firing piezos, and with piezos, we're triggering, because of the mechanotransduction, these receptors open, including this one. And that's the key part, because I had a lot of questions in the New York presentation about how really the toll-like receptors work. And it's very simple, okay? I'm gonna explain it again. Your toll-like receptors is your immune system. They are the big boss of the immune system. Okay, so in every inflammatory response, we're gonna have macrophages there. We're gonna have your immune system running there in the blood flow, right? Changing that. I don't know about anything that can change that response locally. So if we do a knee, we're creating the inflammation to go down because this is happening. And we need a balance, okay? Both of them are important, but the TLR3s, they use another route. They go to the TRIF pathway, okay? And that's key because when this guy is dysregulated, we can use this one. When this one is dysregulated, we are firing this one. So we have double mechanism there that we can use to treat patients. That's why Softwave is a very robust therapy, okay? It's because of the piezo. So mechanotransductions create this process. All right, same thing, okay? TLR3 inside the cell, and 4 should be right here. So 4 use NYDA dependent, and toll-like receptor 3 use the TRIF pathway. And you know, the TRIF pathway is very short. It only goes, right, 1, 2, 3 hours. Your toll-like receptor 4 is very long. So it has a lot of space to fail, to be triggered by viruses, by, you know, all different components of inflammation. So this is inflammation. This is 2022 update of inflammatory response for clinical doctors. This is what's happening. And we're changing that because we can trigger that with the Softwave. All right. I think that's the end.
So just to kind of recap that, our immune system is the defense mechanism for our entire body. And and you can stop sharing, and then we can see your face.
Yeah, that's what I'm trying to do.
And when we are connecting when we're activating our immune system, we're actually we're triggering those first responders to come out into the response. So they're the ones that are coming in. We're hitting by these supersonic sound waves, and they're like, hey, we're getting hit by supersonic sound waves. And so the first people, the first responders are those cytokines, interleukin 3, 6, 10.
Inflammation.
Yeah, toll-like receptors 3 and 4. And that's like the first thing that the body wants to bring is inflammation. And again, I think why we get that wow factor, why we have such a great response is because we're modulating that inflammatory response, right? First you see a spike, and then you see, can you explain
that? Big time. And through that mechanism, we're using the sensory system to go up into the brain and remap everything here. Because if my left knee hurts, it changes everything in my balance, my vestibular system. You know, I'm not gonna keep complicating things, but everything will be dysregulated, right? And so all those balance patients that we have, right? It's chronic pain. It's chronic pain that it's doing it, right? But my main point is Softwave. It's so powerful because you're addressing both systems at the same time. Both everyone that treats the brain, every doctor that knows something about treating brain, they know there's a threshold. There's a threshold. And in order to create new proteins in your body, you need to reach that threshold. That's why we tell them, let me know, do you feel the pain? Because if you don't feel it, I'm gonna go up. You need to meet the pain threshold that's coming from the brain.
one of the things that I think there's some, people that have failed, or they've taken more visits to get to the goals of the patient, are when they don't use the energy level high enough. And I think, chiropractors, 87% of Softwave providers are chiropractors, and we sometimes realize, and acupuncturists and naturopathists know this as well, but sometimes you have to deliver the pain to treat it. That's why I loved your talk in New York, and I love how you've expanded it here tonight, is you're treating chronic pain with pain. And if you don't elicit that pain, you're not really resetting or remapping the brain pathway.
Yeah, we're talking orthopedic here, right?
Sure.
Treating other stuff, it's different, right? So we need to, and that's why Softwave protocols, right, are gonna be updating every time, because research comes, right? It's like everything, research comes, what we see clinically, and that's why everyone here is very important. Every doctor here in this meeting right now, it's very important. I don't care if you see this video 1 year from now, you are very important, right, Dr. Dizuro?
Yes, they are.
Because
Yeah, because we're still scratching the tip of the iceberg. And, thank you for your expertise. We do have one question, a couple, actually, but, and I'll be the moderator. No matter where you treat, is this reaction happening? That's number one. First question. Is that, can you answer that?
So the physiology is the same. We're applying pressure into the cell membrane, and that's triggering that. So yes, essentially yes. Even if they don't feel pain, that's why we're having those stem cells reaction. Why stem cells? From where are they coming? Well, they're coming from your bone marrow, right? From your thymus, but you need to trigger the hypothalamus cascade. And we do that through the pain signal. That's why, do you feel pain? Let me know, I'm gonna crank it up. I need you to feel the pain, because that's gonna rewire the hypothalamic system, their brainstem, their cortex, everything.
Excellent. And the second question was, does Softwave have a list of protocols for use somewhere? Yes, we do. I'll make sure you have that available, Doc. If you haven't got the updated manual, let me know. Dr. Chris Henthorn, who is out of the Veterans Administration and in Orlando, and part of the research team there. He's helped place this in Beaumont Medical Hospital in Texas. He's also has it at El Paso at the VA, and now brought it on in Orlando. And he says, with Matt's cup of water analogy, could this correlate to energy level of soft waves?
Yes. Let me talk about it for 1 second. I'm talking about them feeling pain, but it's not, I don't like going, if I'm firing that pathway, why? It depends. Because if we don't have the cortical inhibition, if that patient, for some reason, doesn't have good brain integrity, we're fighting both systems, right? So if you make them feel a lot of pain, they're not gonna have a good response. That's why if you see the pain level, then you're gonna throw them to the emergency room. So we need to be very careful with the pain threshold.
I trained one doctor. He has one eye. Okay, he's blind in this eye, and I'm always teaching our doctors that you have to keep an eye on the patient, right? And oftentimes, patients want to fight through it, but we've seen numerous times people have vasovagal responses, right? They're like, I'm gonna pass out, or
why
sweaty. Why? Go back to
we're impacting with the pain signal. We know why. And if doctors, if we know why we're doing stuff, how can they react? We can almost, smell what will happen, and they feel your confidence. Confidence makes them sign in. If you're a chiropractor, you need your confidence that you have the best weapon in your hands.
Yeah, I say it, it's like we have x-ray vision, right? Especially when you know the anatomy and you're working. And remember, doctors, This is powerful, intelligent energy. This is one of the reasons why we microdose this. And you must, honor the patient. And Dr. Henthorn also asked, that's why severe pain might need less energy. That's right. Some of these some of these professional athletes and Olympic athlete hopefuls that we've worked on, we have to dial it down sometimes starting at 4 or 5.
Yeah.
It's not because they're wimps. It's because the nervous system is functioning at a higher level and they have more inflammation. Right, Doc?
Yes, sir. That's it.
So, good questions, Dr. Henthorn. You two need to connect. Yes, so adjusting the energy levels is really important. Dr. Henthorn's been with us for over 3.5 years. He's one of the first 10 doctors. He's a pioneer in this field. Thank you. And as all of you are, and you still are. We're still only tapping into 0.5% of all chiropractors and less than 1% of all healthcare providers. Dr. Martinez, as always, you do such a wonderful job at bringing us up. And, it's like, it's not about one doctor knowing everything and hoarding information. It's about rising tides raise all ships. And that's what it's about. And thank you so much for all the work you do and for educating us. I personally want to see Dr. Martinez every month on one of our calls. And he can help keep digging deeper and helping us really find the pathways. So listen, I want to be respectful of everybody's time. We did just about an hour. I'll make this available. We'll have a series in understanding the nervous system with Dr. Martinez. And thank you. And everybody is clapping and raising their hand over here. So they're very grateful.
All right. Thank you so much.
Jen, Jen, who's amazing. Can I reach out for consultation about a specific case? Absolutely. Yeah. Dr. Martinez, I can make his number available, Jen. If you wouldn't mind, I'll type it right to her so she has it. What's your cell?
It's Puerto Rico number. Okay, so 787.
Hold on one second.